Makakalusugan, makabuluhan at maalam na 2:00 ng hapon po sa ating lahat. Maraming salamat po sa ating mga taga-subaybay dito po sa ating Kapihan session with the media via our DOH Facebook and YouTube pages saan mang bahagi ng ating bansa. Kwentuhan at kaalaman, tayo na't magkapihan. This is Jem Valeriano, kasama nyo sa hapong ito para sa isang mahalagang diskursong gigising sa ating kamalayan. Pero bago tayo opisyal na magsimula, let me read first our house rules. To ensure the smooth flow of this session, everyone is encouraged to use the naming convention below for Zoom usernames to ensure proper acknowledgement. Pay attention to the discussion of our health experts and/or resource persons. Keep your microphones muted while speakers are discussing and presenting. Should you have questions, participants shall signify and send them in the Zoom chat box below and wait for the host to acknowledge them. There shall be an open forum after the discussion. Submitted questions will be addressed first by our experts, followed by Zoom chat box questions. Every participant is advised to reserve questions. Paalala lamang po sa ating media partners na kasama po natin sa hapong ito, only questions related to the topic being discussed will be entertained. And lastly, please join the Kapihan session until the end of our program. Sa bawat batang babaeng dinidiskubre pa lamang ang kanyang kakayahan, sa bawat inang nagbigay buhay sa atin at patuloy na itinataguyod at hinuhubog ang pamilya, at sa bawat anak na patuloy na nagsisikap na abutin ang mga pangarap, isang malugod na pagbati po ng isang maligayang pandaigdigang araw ng kababaihan. Itong International Women's Day ay nakapaloob sa ating National Women's Month celebration ngayong buwan ng Marso, kung kaya't makikita natin na napakaraming benepisyo, napakaraming mga aktibidad tayong nakikita saan mang bahagi ng bansa na nagbibigay pugay sa ating mga kababaihan. Pero higit pa sa mga pagkilala na ating natatamasa, kailangan nating malaman kung bakit nga ba lubos na importante ang selebrasyong ito at kung ano-ano ang iba't ibang mga aksyon na ginagawa ng ating pamahalaan upang bigyang diin ang karapatan ng mga kababaihan. Sa katunayan, we have the following legal mandates in recognition of this event. We have Proclamation number 224, Series of 1988, which declares the first week of March of every year as Women's Week, and March 8, 1988, and every year thereafter as Women's Rights and International Peace Day. Another is Proclamation number 227, also signed in 1988, providing for the observance of the month of March as Women's Role in History Month, and RA 6949 series of 1990, which is an act that declares March 8th of every year as a working special holiday to be known as National Women's Day. All of these are signed under the term of President Aquino on April 10, 1990. For this year, tuloy-tuloy po ang ating aksyon under the recurring theme, We for Gender Equality and Inclusive Society. In the 2023 Global Gender Gap Index report by the World Economic Forum, the Philippines maintains its status as the leading Asian country in narrowing the age gap, where it has attained 79.1% gender parity, securing the 16th position out of 146 countries globally, a rise of 3 places from its previous ranking. The Global Gender Gap Index evaluates gender equality and progress across 4 crucial dimensions: economic participation and opportunity, educational attainment, political empowerment, and health and survival. Upang tulungan tayo na i-highlight lalo ang Magna Carta for Women and the Department of Social Welfare and Development's NCR activities in support of National Women's Month, let us all welcome Mr. John Fernandez of the Department of Social Welfare and Development, National Capital Region. Magandang hapon po, Sir John.
Good afternoon po sa ating lahat. Usahan na po natin ang session. Share ko lang. Ayan po. Lahat po ba nakikita ng aking slide?
Yes po, clear po, sir.
So, on behalf of our department po, ako po Jan Fernandez Jr. Ang task ko po ngayon is to deliver our programs and services in addressing women on 2024. So, Magna Carta. Okay? Kapag sinabi po natin Magna Carta, ano nga po ba ang Magna Carta? Ito po yung document constitute a fundamental guarantee of rights and privileges. So sa Magna Carta po, isinabatas po ito noong 2009, August, nung si Gloria Macapagal Arroyo pa po ang presidente po natin, na kung saan it seeks to eliminate discrimination against women by recognizing, protecting, fulfilling, and promoting the rights of Filipino women, especially those in the marginalized sector. So ibig sabihin na nun, ang Pilipinas po, okay, nag-promise po siya sa mga kababayan na Pilipina na pangangalagaan niya, poprotektahan niya at ipopromote niya po ang lahat ng karapatan ng bawat Pilipina. Okay, kababayan Pilipina. Okay? So it also affirms the role of women in nations building and ensures the substantive equality amongst men and women rights as human rights, and affirms women rights as human rights, then condemns discrimination against women. So kung mapapansin niyo po, ang Magna Carta of Women po is nakatalaga specifically po pangkababaihan lamang po siya. Okay? So discrimination against women. Any gender-based distinction, exclusion, or restriction which has the effect of purpose or failing or nullifying the recognition, enjoyment, or exercise by women, or irrespective of their marital status on the basis of equality of men and women, human rights and fundamental freedoms in the political, economic, social, cultural, civil, or any other field. So, ibig sabihin lamang po nito, okay, ninunullify po nila or ni-eliminate nila ang discrimination against women. So, any practices of discrimination is hindi na po pwede sa mga kababaihan. Okay, punta naman po tayo sa mga karapatang pangkababaihan. Ayan. Ito po isa sa mga karapatan na kung saan itatag din po ng ating republika na isinabatas din po sa atin dito sa Pilipinas. Andiyan po yung protection from violence, andiyan po yung RA 9262 or the anti-violence against women and their children, protection and security in the times of the disasters and calamities. Kung mapapansin niyo po, dito sa protection and security in times of disaster and calamity, every time po nagkakaroon po tayo ng disaster or sunog, nagkakaroon na po tayo ngayon ng mga shelters, then may mga privacy tent na rin po tayo. Isa po yan sa mga practices na tinutupad po ng ating rights. Okay, participation and representation, equal treatment before the law, equal access and the elimination of discrimination in education, scholarship, and trainings, women in sport, women in military, non-discriminatory and non-derogatory portrayal in media and films. Ito po ang pinaka-challenge po sa atin ngayon, no? Yung non-discriminatory and non-derogatory portrayal in media and films, including na po yung social media. Okay? So, i-call na po natin yung attention. Gamitin po natin itong venue na to para to call the attention of the users social media na kat maaari, no? Diba? Paiba-iba na rin po ang henerasyon ngayon. So, hanggat maaari, diba, limit na natin yung pag-expose, okay? Pag-abuse, okay, sa mga kababaihan or portrayal sa mga kababaihan. Okay? So, right to health. Okay? Andiyan po yung PhilHealth po natin for that. Special leave benefits, equal rights in all matters relating to marriage and family. Po, another po na rights na mga kababaihan po natin para naman po sa mga marginalized or nasa mga laylayan. Yan, dyan po yung food security and productive resources po natin. Right to housing, right to decent work, right to livelihood, creative capital and technology, right to education and training, right to representation and participation, then right to information, social protection, recognition and preservation of cultural identity po para po sa mga indigenous people natin, and peace and development. Lahat po itong karapatan na po ito may tatalakay natin mamaya doon sa mga programs and services po natin dito sa department. Okay? Ano naman po ang women in especially difficult circumstances or WEDC? Okay? Sila po yung mga victims of trafficking, survivor of sexual, physical, and abuse. Okay, so ano po yung mga binibigay po namin na service sa kanila? Andyan po yung temporary and protective custody po para sa mga bata at kababaihan po na kung saan inilalagak po namin sila sa mga centers po sa National Capital Region. Meron po tayong medical and dental service, psychiatric evaluation, productive skills and capability building. So hindi po porket nasa loob po sila ng mga centers, andun na lamang po sila for habang inaayos po yung kanilang papers. Hindi po siya ganun. So habang po nandun sila sa loob ng centers, sinisikap po namin maging productive po sila para paglabas po nila sa society again is makarecover po sila, ma-address po yung mga needs nila at alam po nila at kaya po nilang makatayo psychologically sa kanilang community. Okay? Legal services, livelihood assistance, job placement po, financial assistance, and travel. Okay? Dito naman po sa mga ating institutional mechanisms, andyan po yung gender mainstreaming po natin, gender focal point, officers in the Philippine embassies and consulates. Okay, lahat po naman tayo dito sa government institution po natin, sa mga agencies po natin, meron tayong God focal point system. Okay, Philippine Commission on Women, Commission on Human Rights. As the Department of Social Welfare and Development, National Capital Region has always been at the forefront of the advocating for the rights and welfare of girls in our community. This year, teams Tipo ng Patas sa Bagong Pilipinas, Kakayahan ng Kababaihan, Patunayan, emphasize the significance of empowering women and ensuring their access to opportunities that enable them to develop without any discrimination, violence, and inequality. Okay? So ito po yung mga legal mandates kanina na banggit na po ng ating host. Andyan po sa Republic Act 6949 na kung saan dinedeclare po ang March 8, ngayon po yon, of every year as the working special holiday to be known as the National Women's Day. Okay? Another legal mandates po natin, yung Proclamation number 224, series of 1988, declaring the first week of March of every year as the Women's Week and the March 8, during that March 8, 1988. Okay? Then another po, Proclamation number 227, series of 1988. Nakapaloob din po doon yung providing for the observance of National Women's Month. Okay? So, buong Marso po ito. And iba't iba pong agency na nagpa-participate to celebrate month-long activity on po. Ano po ang role ng ating Department of SWD? As one of the lead agencies, okay, together with the PCW or the Philippine Commission on Women, the SWD-NCR po is committed to ensure that women, especially those from the marginalized sector, are empowered to reach their full potential. Okay? It also plays a pivotal role in promoting gender equality and inclusivity through its various programs and services. It also advocates for the policies and initiatives that promote the welfare and rights of women and uphold their dignity and worth. So si DSWD po hindi po more on food and financial assistance, etc. po. Okay, so sa DSWD po, dinedevelop po namin dito, okay, hindi lang siya financial assistance, food assistance, psychological assistance, yung behavior and character po ang build po namin sa department. Okay? So, historical context lang po namin ito. Background lamang po ng mga aktibidades ng DSWD po. Ayan. DSWD acknowledged the rich history of women's empowerment movement in the Philippines and continues to support initiatives aimed at advancing women's rights and opportunities. Also recognize the need for ongoing effort to address gender disparities and discrimination. Kung mapapansin niyo po, araw ng kababaihan po ngayon, pero meron po tayong kalalakihan doon sa imahe. Okay, so isang malaking factor po ang partisipasyon ng mga kalalakihan sa pag-celebrate po sa araw ng mga kababaihan. Kasi po usually, okay, based po dun sa history, kadalasan po ang perpetrator po natin dito or kadalasan ang cause ng mga abuses and violence ay ang mga kalalaki. So sa DSWD po, ginagamit po ng ahensya ang kapasidad ng mga bawat lalaki, mga tatay po, empower din po namin sila to address this type of violence and abuse para maitama natin ang traditional na macho images po. Okay? Ang key issues po natin dito is despite of advancement, okay, women still face barriers such as gender-based violence, limited access to education and healthcare, and economic inequality. So the department is dedicated to addressing these challenges through its programs that provide assistance, protection, and empowerment to their family. So po ang mga initiatives po namin, meron po kami, first of all, meron po tayong mga shelters and residential care facilities. Okay, showcase the DSWD NCR initiative services aimed at promoting gender equality and empowering. Highlights the programs such as livelihood assistance, psychosocial support, and gender-responsive social protection that cater to the specific needs of women. Share success stories of women who have benefit from the SWD NCR programs, become at their champion, na kung saan sila po yung ginagawa namin hemplo as success story po ng departamento. So since kaya po ng isang kababaihan na gawin yon, why not po yung iba pa po nasa lilayan? Okay po. Yan. Punta na po tayo dito sa programs and services. Yan po yung Sustainable Livelihood Program po namin, na kung saan community-based capacity building programs that seeks to improve the participants, okay, to increase their social economic status. Okay, andyan po yung textbook skill training, pre-employment assistance, cash for building livelihood assistance, seed capital fund. So lahat po ito sa SM po. Okay, coordinated po ito sa down to LGU po natin. Meron tayong project development officers sa baba. Okay, sa mga cities po natin at nababa naman po ito sa mga kanilang barangay. Po. Another program po natin, yung protective services for the individuals and families in difficult circumstances. Okay, o yung AX po namin, yung assistance to individual in crisis situation. Okay. Ito po yung mga binibigay po namin financially or medical assistance. Na kung saan kapag may bigla pong individual na crisis, for example, nasunugan, namatayan, sana. Pero yun po yung mga nilalapit po dito. Okay, provision of medical burial assistance. Okay. Further po, the program to provide immediate assistance to individual and families facing crisis situations such as natural disaster, accident, or other emergency. It offers various forms of support including financial aid, food assistance, medical assistance, and other services to help alleviate the impact of the crisis on the affected individuals. Okay, so yan po yung financial assistance po namin. Again po, yung mga requirements po niyan, usually lang po yung barangay certificate, IDs, na nagpapatunay na ikaw po ay talagang in need individual po. Okay, transportation assistance, medical assistance. Okay, so medical assistance po, nandun po yung medical abstract, study po, burial assistance, educational assistance, and food assistance. Lahat po ng mga requirements po nito nasa website po ng DSWD po namin. Pwede po tayo mag-apply just in case po na may bigla ang crisis po sa ano. Okay? Then the beneficiaries. Sino po ang pwede maka-avail nitong mga programs and services na to? Okay? The beneficiaries are the individuals and or the families who are indigent. Okay? Kapag napatunayan po na indigent po siya, ayan, eligible po siya sa programs and services po natin or that is specific service po natin. Okay, andyan po yung vulnerable, disadvantage, or otherwise in crisis situation based on the assessment of the social worker po dun mismo sa CIO office po natin. Okay, so dun po tayo magkakaroon ng interview, dun po tayo magkakaroon ng evaluation assessment kung talaga bang eligible isang individual to avail that type of service. Okay, the eligibility of the client to avail the service shall be determined during the interview and the scrutiny of the supporting documents presented. Okay? The social worker shall discern the capacity of the individual or the family to address the problem by looking keenly on the available resources that the family could access to utilize or ma-maximize para sa kanyang development. The assessment of the social worker shall be the basis of the recommendation. Okay? So, in collaboration and partnership po, medyo hati lang po siya. Okay? So, meron po tayo ditong RIAC at BAUSI or the Regional Interagency Committee Against Trafficking and Violence Against Their Children. Okay? Sa regional level po yun. Sa local council naman po, meron din po yan sa kanya-kanyang. They emphasize the importance of the collaboration and partnership in advancing gender equality and inclusivity. Okay, the DSWD-NCR works closely with the government agency, civil society organization, and other stakeholders to strengthen their effort promoting women's rights and welfare. Okay, encourage continued collaboration to the maximum resources and expertise in addressing gender-related issues. So, kung mapapansin nyo po, meron po tayong Kalipi or di Kalipunan ng Liping Pilipina. Okay, meron po tayong mga provision of technical assistance sa mga service providers po natin yan sa mga local government. Okay? Call to action po namin, siyempre encourage individual and organization to support the SWD-NCR initiative and advocate for gender equality in their respective sphere. Okay? Call for the increased awareness and action to address gender-based violence and discrimination, then empower women by promoting access to education, economic opportunities, and decision. Oh. Before po ako mag-close, ito lamang po ay isang African proverb. Okay, na nakita ko po sa social media rin po. So, sabi po rito, when you educate a man, you educate an well. You educate a woman, you educate a entire generation. Okay? Since po, mga kababaihan po ang nangangalaga sa ating mga anak at sila po ang magdadala sa susunod na henerasyon. Kung tama po ang pagpapalaki at tama po ang mga information at tama po pag-i-educate natin sa mga kabataan, magiging tama rin po ang landas nila at tama rin po ang pakikitungo nila sa mga hinaharap pa na henerasyon. Okay, yun lamang po. Maraming salamat at maligayang araw ng kababaihan sa ating lahat. Thank you po.
Maraming salamat po, Mr. John Fernandez from the Department of Social Work and Development National Capital Region for giving us an overview of the Magna Carta for women. What are the rights that our women population has, and at the same time, the services that the national agency is offering for every Filipina. So bago po natin, kailangan po natin tutukan palalo ang ating kapihan session because we're going to be presented with the programs when it comes to the health paradigm. And let me introduce to you our next speaker. So our next speaker is Medical Officer 4 from the Dr. Josefa Bella Memorial Hospital. And in relation to the National Women's Month, titingnan naman po natin ng lente pangkalusugan kung ano-ano nga po ba ang mga inisyatibo na meron tayo para sa ating mga kababaihan. Let us all welcome Dr. Gay M. Sagun Madalastas. Magandang hapon po, Doc.
Magandang hapon po sa inyo lahat. So I'll start sharing my slides.
You can have the floor po, Doc.
Thank you, Ma'am Jen. So, once again, magandang hapon po sa ating lahat. So, I'll be discussing one of the national program for National Women's Celebration. So, I'm Dr. Gay M. Sagun Manalastas, Medical Officer 4 of Comprehensive Family Planning Center, Dr. Josefa Bella Memorial Hospital. So, one of the national program is in celebration of National Women's Month is family planning. In fact, family planning is one of the 12 elements of reproductive health care. So, pag sinabi po nating reproductive health care, this refers to access to a full range of methods, facilities, services, and supplies that contribute to reproductive health and well-being by addressing reproductive health-related problems. When we say reproductive health, this refers to the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in all matters relating to reproductive system and to its functions and promises. So family planning refers to a program which enables couples and individuals to decide freely and responsibly the number and spacing of their children and to have information and means to do so, and to have access to a full range of safe, affordable, effective, non-abortifacient, modern, natural, and artificial methods of planning pregnancy. So the Republic Act number 10354 is an act providing for a national policy on responsible parenthood and reproductive health. It was finally passed by the Senate and the House of Representatives on December 19, 2012. So I just want to highlight some of the contents of the RPRH of 2012. So the state recognizes and guarantees the promotion of gender equality, gender equity, women empowerment and dignity as a health and human rights concern and as a social responsibility. The state also guarantees universal access to medically safe, non-abortifacient, effective, legal, affordable, and quality reproductive healthcare services, methods, devices, supplies which do not prevent implantation of a fertilized ovum as determined by the FDA. The state also shall respect individuals' preferences and choice of family planning methods that are in accordance with their religious convictions and cultural beliefs, taking into considerations the state's obligations under various human rights instruments. Informed choice and voluntarism shall be promoted by all public and private healthcare providers rendering reproductive healthcare, and all accredited public health facilities shall provide a full range of modern family planning methods. No person shall be denied information and access to family planning services, whether natural or artificial, provided that minors will not be allowed access to modern methods of family planning without written consent from their parents or guardians, except when the minor is already a parent or has had a miscarriage. And lastly, in case of married couples, spousal consent is needed, provided that in case of disagreement, the decision of the one undergoing the procedure shall prevail. So for the past few years, actually bago po lumabas yung RPRH Law 2012, the Dr. Jose Fabello, which is a 700-bed capacity, level 3 specialty and end referral hospital, also a teaching and training hospital for obstetrics, gynecology, anesthesiology, newborn medicine, and pediatrics, and also has a fellowship training program in family planning, has been rendering or has been an advocate of women empowerment and gender equality. So in the year 2000, the hospital was mandated as the National Maternity Hospital by virtue of DOH Administrative Order number 11 series of 2000. So kagaya po ng sinabi ko, this hospital has always been an advocate of women's rights, gender equality, and empowerment. And gaya din po ng sinabi ko kanina, one of the services that being offered by our hospital is family planning. So the comprehensive family planning has been operating with the objective of supporting the Philippine Family Planning Program from initial population regulation and now to responsible parenthood, with goals of maternal and child health and family welfare through an intensified information, education, communication, and motivation supported FP service delivery and manpower and development. Also, our center is also now open and accepting clients at the new Fabello Hospital located at DOH compound. So the center's vision is to empower Filipino men and women to exercise their rights to achieve their desired family size through universal access to family planning program and services. And our mission is to ensure the availability of safe and effective modern family planning methods and services. So since 1970s, the Comprehensive Family Planning Center of Fabello Hospital has been rendering family planning services to the community, especially to the poor and the marginalized population. So we've been providing counseling, provision of family planning methods like pills, condom, injectables, implant IUD, BTL, and vasectomy. And over the years, our staff has been conducting family planning lectures to patients during prenatal checkup at the OPD and after delivery at the ward. Also, the Comprehensive Family Planning Center is a DOH accredited training institution providing experience, expertise, and technical assistance for health workers involved in family planning. In fact, the center is in constant communication with family planning coordinators of the different regions to identify health workers who are in need of further training in family planning to enhance their service provision and improve the contraceptive prevalence rate and decrease the FP unmet need in the region. So kung mapapansin niyo po sa ating pictures, most of our participants were women. The center has been also conducting free medical missions to different regions of the country. And in addition to our program, a one-year fellowship training in family planning was started in 2017. Currently, we have 3 fellows, 2 from Region 2 and 1 from Batangas Medical Center undergoing the training program. In keeping up with times, especially during the pandemic, the center has launched teleconsult through SMS and social media platforms like FB page and Viber to expand our capacity to address family planning concerns to our clients. We also conducted family planning webinars and Zoom meetings in partnership with POGS and PSRP, and some of us were even invited to be a resource speaker in TV and radio programs. So the following slide, I will be showing you the number of acceptors from 2019 to 2023. So as you can see, there is a decreased number of new acceptors for 2020 and 2021. This is due to decreased number of hospital admissions. However, by 2022 and 2023, there is an increase in new acceptors. This is partly because we have improved our vasectomy services and strengthened our linkages with our partners. The CFPC is continuously working with DOH, CHD, LGUs, and NGOs like USAID, Friendly Care Incorporated, Likhaan, and among others in the implementation of our programs and ensuring the availability of family planning information and services, especially to women who need them. Lastly, with the comprehensive family planning of Dr. Jose Fabella Memorial Hospital is dedicated in celebrating the accomplishments and contributions of women throughout history. We aim to continuously promote gender equality and highlight women's achievements in various fields towards a more inclusive and equitable society. We support and promote this year's theme, Lipunang Patas sa Bagong Pilipinas, Kakayahan ng Kababaihan, Patutunayan. Thank you and good day.
Maraming salamat po, Doc Gay, for providing us an overview of the family planning and healthcare services that we are affording our women, and at the same time, what progress we currently have. Dahil nga meron tayong mga FP acceptors data na makikita natin na nagbunga dahil nag-a-avail na ng services ang ating mga kababaihan at nababawasan na yung mga kaso kung saan lumalala po yung kanilang kondisyon dahil nga hindi po natututukan ng medical attention. So for this part of our program, we're going to move to our question and answer portion. So ito pong mga tanong na ito ay nakalap po natin through our announcements wherein we gathered our advanced questions from our media partners. So let me call on Sir John Fernandez again to the floor, and at the same time Doc Gay Manalastas. Okay, so for our first question, this is for Mr. John Fernandez. In the context of National Women's Month, what partnerships or collaborations has the SWD-NCR established with other government agencies, NGOs, or community organizations to amplify the impact of their efforts in advancing women's rights? Sir John?
Po. So sa DSWD po, tulad po na nabanggit natin kanina, meron po tayong Regional Interagency Council Against Trafficking and Violence Against Women and Their Children or the RIACAT-BAUS. So meron din po tayo dito na Men Oppose Violence Everywhere. Yan po yung MOVE. Okay, kung familiar po tayo sa MOVE, yan po yung mga grupo ng mga kalalakihan na kung saan po binabalik namin yung imahe ng isang lalaki or ng isang tatay na kung saan nabubura na po sa lipunan ngayon, society natin ngayon. Real talk lamang po, no? Kapag sinabi po kasing lalaki usually ngayon sa social media, di ba, napaka baba. Hindi naman ganun kababa, pero negative ang dating ng mga kalalakihan usually po sa social media ngayon. Okay, so dito po sa Menopause Violence Everywhere po, dito po namin nilalakad yung mga bukod sa programa, syempre yung imahe po ng tatay, ng lalaki, ng partisipasyon namin na hindi lang po kami puro ganon, hindi naman po puro negative ang dating namin. Okay, kasi po malakas po maka-impluwensya ang social media sa panahon ngayon. Okay, mas na ano po siya, mas na-amplify po siya, lalo na sa mga negative. Okay, so meron din po tayong Kalipi or the Kalipunan ng Living Pilipina. Yan naman po yung samahan ng mga kababaihan na kung saan sila rin po ang nagtutulungan, nag-ahalinsunod po doon sa mga local government units po natin. Okay? So sila po yung mga grupo ng kababaihan na leaders po sa mga communities po natin. Sila na po yung grupo na kung saan may access po at may alam patungkol sa mga batas, lalo na po yung RA 262, yung anti-VAUSI po. Ayan, sila po yung kakakabisado ng mga referral pathway po natin kung paano magsumbong, saan magsumbong. Ayan po, sila rin po yun. Okay, yan po ang mga kalipi po natin. Okay, so ano pa po ba? Ayan po, meron siyempre yung DSWD po, may centers and residential care facilities na nag-entertain po selected po mga kababaihan at kabataan. Okay, yun lamang po.
Maraming salamat po, Sir John, for providing us inputs on how the DSWD has been constantly forwarding women's rights. And at the same time, na makikita po natin sa presentation nyo po kanina, how sustainable livelihood programs are also incorporated. Dahil makikita nga po natin na malaki po yung nagiging papel ng economic advancement din sa mga kababaihan upang i-attain nila yung rights na talaga namang karapat-dapat po na meron sila. So we have here another question from the media, and this is for Dr. Gay Sagon Manalastas. So Doc, ito po yung question nila. Paano po makakatulong yung mga programa ng Dr. Jose Fobella Hospital in terms of addressing unique healthcare challenges that women face throughout their life stages from adolescence to menopause and even beyond po? Go ahead po, Doc.
Thank you, Ma'am Jen. So for the FP program, we are catering women of reproductive age, which spans from adolescence to perimenopause. So we are considering the different reproductive health concerns and conditions of these special, we call them special populations, which spans across the different life stages. So there are different family planning methods and practices that we offer to clients according to their reproductive needs. Halimbawa po sa mga adolescents natin. So family planning programs can provide education and access to contraception methods, helping young women make informed choices about their sexual and reproductive health. So this includes information about puberty, menstruation, and preventing unintended pregnancy. Another example is for the pregnancy and childbirth na life stage. So family planning programs support safe motherhood initiatives, providing prenatal care, skilled birth attendance, and postnatal support. So this reduces the risk of maternal mortality and ensures healthy outcomes for both mother and babies. Sa mga beyond menopause naman, women's health needs continue beyond menopause. Family planning programs can offer screenings for age-related health issues such as osteoporosis, cardiovascular disease, and certain cancers. Additionally, we can provide support for sexual health and intimacy as women age. So overall po, yung family planning programs contribute to women's overall well-being by empowering them to make informed decisions about their reproductive health at every stage of their life.
Maraming salamat po, Doc Kay. So makikita po natin na holistic po ang approach. Holistic po yung approach na ating itinitake para po makapag-provide ng ganito pong klaseng medical attention to our Filipinas. This next question po is for Sir John Fernandez again po. Sir, this is the question. Looking forward, what are the key priorities or focus areas of DSWD NCR in promoting gender equality and supporting women's empowerment, both in the short term and long term? Sir John? Sir John, I think your microphone is muted po ata.
Okay po.
Ayun. Okay, so go ahead po.
Bali sa departamento po, isa lamang po yung usual po na pinapractice po namin. Kaya yan po yung pagsusulong ng mga advocacy programs po namin, yung pag-aabot namin down to barangay level po, patungo sa kanilang bawat bubong, sa kanilang mga pamilya, na kung saan doon po yung nilalapat po namin yung tamang education patungkol sa pagpapamilya na rin or sa pangkababayan, yun po yung mga batas natin sa Pinas, kahit paano po i-express po namin yan through community meetings, okay, through FDS, po yung mga programs services, nilalatag po namin sa kanila. Kasi po, if you are planning to a long term, we educate the people. Okay, if we educate the people, ayan po, sasalin-salin na po sa susunod na henerasyon po, yung tamang edukasyon, yung tamang behavior, which is magre-reflect yan sa tamang society. Okay, so unti-untiin po natin. Okay, so isa po itong maganda, itong platform po natin ngayon, kahit paano medyo accessible sa lahat. So, yun lamang po.
Maraming salamat po, Sir John. So as we can see from there how important raising awareness is in order to implement or all the visions that we are trying to put into practice, we need to have knowledge first. We have to empower our women, and at the same time, kung alam nila ang kanilang mga karapatan, alam nila kung paano nila ma-access yung mga serbisyo na nararapat para sa kanila, dapat meron din yung plano at aksyon na pwede nilang gawin para kapag pinagsabay natin 'to, we can ensure that these initiatives that we're trying to put forward to enforce and at the same time to promote their rights will be in effect. So a next question po will be for Doc Gay naman po. So speaking of raising awareness, ito naman po Doc Gay, what role can community-based initiatives play in improving access to essential healthcare services for women, especially those in underserved or marginalized populations? Doc Gay?
Yes, so community-based initiatives can bridge healthcare gaps by increasing awareness about women's health issues, available services, and the importance of seeking timely care. By providing culturally competent care to ensure that women feel comfortable seeking care and receive services that are sensitive to their beliefs and practices, also offering outreach programs and providing localized services. In our center, we capacitate healthcare workers by training them on different family planning services for them to be able to provide family planning services in their community. We also conduct family planning missions to GIDA, or the geographically isolated disadvantaged area. By bringing healthcare services directly to the community, they overcome barriers such as transportation, cost, and lack of awareness. And lastly, these initiatives address specific needs, foster trust, and empower women in underserved areas, ensuring better access to essential healthcare services specifically family planning and promoting overall well-being of women and their families.
Maraming salamat po, Doc Gay, for giving us how the communities, di ba nga kung titingnan natin, before we go to a national scope, bago natin tingnan also at a more at a wider level, we have to learn how to address these issues at our own centers, di ba? Doon mismo sa ating mga komunidad, kailangan natin magkaroon ng konkretong aksyon, and at the same time, we have to raise awareness among the members of our community on where we should focus on and how to address these issues such as family planning. So for our last question po, this will be both for Sir John Fernandez and Doc Gay Manalastas. What do you think are the areas in your respective spheres, both in health and social work, do you think needs improvement in order to forward the rights of women as we celebrate National Women's Month? So Sir John, you can go ahead first po.
Ayun po. So, sa nakikita ko po ngayon, opinion ko lamang po ito, ano? Okay po. Kasi sa dali na pong access natin sa mga information technology po natin ngayon, one click away na lang po tayo sa lahat ng kailangan po natin. Pati Shopee, nandun na. Okay? So, kumbaga yung focus ng attention ng mga bawat Pilipino, kailangan siguro natin kahit papaano masala or ma-prioritize natin or ma-review po natin kung ano talaga ang mga talagang pangangailangan nila at yung target, okay, na kailangan i-address patungkol sa mga tulad nito, violence and abuse. Okay? So, usually yung participation nila na kung ano yung magagawa pa nila, kung ano yung mga potential nila, kung paano natin sila ma-acknowledge sa kanilang maximum potential to contribute a positive change sa kanilang mga community. Yun sana yung maikalat natin through social media. So, hindi puro drama, hindi puro fears, hindi puro, much better kung puro ganito na kung saan after natin ma-view, after natin kahit pa paano konting attention, may natutunan po tayo. Okay? May natutunan tayo na hindi siya nakakabigat ng loob, hindi siya nakakadagdag stress or anxiety, which is makakapag-build pa sa ating persona at sa ating belief system na kung saan meron tayong pag-asa maging umasenso sa Pilipinas. Okay, yun lamang po. Maraming salamat.
Maraming salamat po, Sir John, for giving us an insightful way kung paano pa natin may improve dahil nga in celebration of National Women's Month, we can only go forward. Doc Gay, for your inputs po.
Okay, so one initiative is to increase yung representation ng mga kababaihan in leadership roles of the institution's program. So mentoring subordinates can also aid in providing an environment that provides equal opportunities for everyone, especially for women. Mentor-mentee program made up of representative leaders can provide as a great support system for women beginning their career. So launching a diverse, equal, and inclusive FP campaign within our organization will address gender inequity, and it involves not only of the partners but both to ensure equal representation.
Thank you very much, Doc Gay. This is in line also with our recurring theme, which is we, which represents women and everyone and at the same time women, which represents women empowerment. So this is a recurring theme from 2020 to 2028 po para po sa ating International Women's Month. So before we end our Kapihan session, I'm going to ask both of our speakers to give our viewers their takeaway messages. So let's go with Sir John first.
So, tulad po ng sinasabi natin kanina, mula po sa kagawaran ng kagalingan at pagpapaunlad panlipunan, okay? I-focus po natin ang attention po natin. Pahalagahan po natin ang attention po natin. Sa ngayon po, sa buwan ng kababaihan, pangalagaan po natin ang ating attention patungo sa development ng bawat kababaihan sa bawat tahanan po natin. I-appreciate po natin yung pagkakataon na to. Sila naman po, batiin natin. Sila i-acknowledge natin sa kanilang effort at sacrifices po sa pagbibuild ng isang society. Kaya yun lamang po. Maraming salamat.
Thank you po, Sir John. Doc Gay Manalastas, for your final remarks po.
Yes, of course, sa lahat ng mga kababaihan na nandito ngayon, nanonood at nakikinig, I just want to greet you all a happy National Women's Month. Let's celebrate the strength, resilience, and achievements of women everywhere. And let's continue to empower and support each other in breaking barriers and shaping a more inclusive future. Thank you.
Maraming salamat po sa ating mga eksperto na nagbahagi po ng kanilang panahon upang magbigay sa atin ng kaalaman ukol sa National Women's Month. Dito lamang po ay nagpapatunay that through the collaborative efforts of women and everyone, achieving gender equity becomes a tangible possibility po para sa ating lahat. This has been Jeff Valeriano. Nagpapasalamat po tayo sa ating media partners na paulit-ulit po sumasama sa atin sa pagpapalaganap ng impormasyong pangkalusugan. Nagpapasalamat po din tayo sa lahat ng ating viewers na tumututok sa anumang bahagi ng bansa. This has been Jem Valeriano na nag-iiwan po sa inyo ng mga katagang babae ka, di ka labang ilaw ng tahanan, kundi ilaw din ng kinabukasan. Salamat po sa pagsama sa amin sa isang hapon ng kwentuhan at kaalaman para sa bagong Pilipinas kung saan bawat buhay mahalaga. We will see you again next Kapihan, 2:00 PM. Maraming salamat po.